Hello and welcome to this session of the medical debate where we will be talking about obesity. So what exactly is classified as obese? The body mass index or BMI is a measure of someone's proportion of height and weight to their age. In an adult, generally having a BMI of 18.5 to 24.9 is considered a healthy weight. Having a BMI of 25 to 29.9 is considered overweight. Having a BMI of over 29.9 is considered obese. To calculate your BMI, you can use the NHS BMI calculator on their website. And being obese obviously presents many health concerns, not least of which is the susceptibility to health problems, and including heart problems. We will talk about this further on slides to come. So let's talk about some heart problems that can be caused. So heart attack. When people ingest too much fat via their diet, fatty deposits can actually build up in blood vessels. This narrows the lumen of the blood vessel, which leads to blood pressure increasing. Suggest why the blood pressure increases in that vessel. Can anyone explain that? I urge you to pause the video here so you can try and explain that and then resume. So if you want to pause it now. Otherwise, we're going to carry on. In fact, the lumen can constrict so much that blood cells cannot get through, and this means the heart is not getting blood. This causes a heart attack. Symptoms include shortness of breath, chest pain, sweating, and dizziness. This is just one of many diseases potentially caused, including diabetes, stroke, many types of cancer, and generally can cause a lower quality of life when someone is obese. So responsibility of treatment is something that's an interesting ethical issue. The NHS does not offer liposuction for free, which means patients who want to have a liposuction done must pay for it privately. I highly recommend everyone understand what a liposuction is. It's not covered in this video because we thought it was too simple to cover, but we really urge you to learn what a liposuction is because it's a common treatment for obesity. Liposuction could be a possible treatment for obesity as the process involves small, inconspicuous cuts and sucks out small areas of fat. Patients should normally be able to return to normal activity after a few weeks after having the surgery done. Therefore, should the treatment be offered under the NHS, seeing as the obesity rate in the country is so high? I'm going to give everyone 2 minutes for this, and then we will reconvene. If you wish to carry on with the PowerPoint and the video rather than waiting for 2 minutes and answering the question, then please feel free to skip 2 minutes ahead and we will carry on with the PowerPoint. The 2 minutes start now. Okay, so that's 2 minutes up, and we're going to carry on. What does everyone know about diabetes? Maybe does anyone know about treatments, symptoms, statistics? Please feel free to put your answers for any questions we've asked, including the question that we asked in the previous slide in the comment section. We would love to read some of your answers, and feel free to write as much detail as you want so we can read through the different things that people have to say. Should this be offered? So let's talk about, should this be offered under NHS, seeing as the obesity rate is so high? So offering it under the NHS means that people can, more people who are potentially obese can actually access this treatment and potentially have a better quality of life. So this actually helps with the justice pillar of ethics, because then more people can access a treatment which may help them. Right now, if because liposuction is not under the NHS, only people who can afford it and who may be a bit wealthier may be able to access a treatment which may help with obesity. However, people who are not so fortunate then won't be able to afford it. So that helps with the justice pillar. With autonomy, it's also helpful because then people can choose to get it and they have that autonomy there to be able to get the treatment because it's free. However, right now, again, because people don't always have that choice, then they might not be able to access it. And again, for beneficence and non-maleficence, it seems like a good idea to offer it under the NHS because then you're helping out the patient. And yes, it would be a painful procedure and it is a surgery, or minimally, we don't know how painful it is, but it is a surgery, so it does cause some physical harm. But in the longer run, that could actually be a fruitful treatment for obesity, so that's in the best interest of patients. So what does everyone know about diabetes? So diabetes, you should know there are two types. There could be a third, but we're going to focus on two types. Insulin injections are it's not a cure, but it's sort of a treatment which helps mitigate the symptoms. The symptoms could be you get really hangry, you have a higher blood glucose than normal. One type of diabetes can have a genetic factor, one has more of a dietary factor. And statistics wise, the statistics is not something we're expecting you to know off your head, but it wouldn't hurt to research some statistics about diabetes and know them off by heart, just so you know, so you sort of gauge the prevalence of diabetes in the country. So we're going to think about a ethical conundrum. Should parents not be allowed to oversee the diet of their baby up until a certain age? So that means that the question's literally asking, should the diet of a baby be controlled by the NHS or by a healthcare provider rather than the rather than the parent for the first few years of their life? And this potentially presents a few problems as well as a few benefits. I'm going to give everyone 2 minutes to think about this, and then we'll reconvene and talk about it. So 2 minutes starts now. Okay, so that's 2 minutes, and we're going to now talk about some of the possible benefits and negatives of this. So, if we think about the four pillars of ethics, for example, beneficence, if the healthcare provider looks after the diet of a baby and then the baby's not fed anything else, then it's quite possible that the baby will be fully having a good nutrition and be fully fed at all times, because the healthcare provider will look at the science behind the diet and make sure that the baby is fully fed at all times. Um, Non-maleficence is sort of the same thing, because only problem is that you're trying to do as little physical, you might be causing some emotional harm on the parents, because the parents might want to feed it different things, maybe treats which might not be so healthy, or cultural foods which may not be so healthy but are still a big part of that family's culture. And um, that could be sad if they're not allowed to feed that. Justice wise, it would mean that all babies get the same nutrition, because all babies would be fed according to an NHS provider. So all babies would be properly have proper nutrition and taken care of. But then the autonomy of the possibly the baby and the parents is compromised, because parents might want to feed the baby something else but they can't, and the baby might not want to eat the prescribed food but it doesn't have a choice. So there are lots and lots of ethical viewpoints to consider, and this is a potentially difficult debate topic, but is it possible for body positivity to go too far? If patients don't listen to their doctors when they say the patient is overweight due to body positivity, whose fault is this? Is it right for a doctor to tell a patient to lose weight? Can body positivity be used as an excuse to mask serious weight problems? And is body positivity always positive? So this is circling around the fact that body positivity is a good thing. It's meant to show you that you should feel comfortable within your own skin. But then obviously with the increase in prevalence of social media, you can see models with six pack abs and all these people who have the perfect or quote unquote the perfect body type, but not everyone has that body type. In fact, very few people have the quote unquote perfect body. And so the whole point of body positivity is for people to feel good in their skin, that you don't need that, and that's people have chosen to do that, but you don't need to have that to be accepted and to feel happy. But then can it be used to mask potentially serious weight problems? If you're overweight and you feel I should feel comfortable with my own skin, you should definitely feel comfortable. But then could it be unhealthy when you're not looking at some maybe that you do have a problem with your weight but you're not looking at it? So it's quite a difficult debate to consider, but it's something that's important nonetheless. And the last question that I wanted to consider, and I'll give you time for, is should there be a fat tax or a tax imposed on people for not taking care of their weight and health, but still using the NHS for free, leading to arguably unnecessary extra strain on the NHS? So I'll give you 2 minutes to think about this, and then we'll reconvene and carry on with the PowerPoint. 2 minutes start now. Okay, so that was 2 minutes, and we're just going to talk about this a little. So I, you know, should there be a fat tax? So autonomy is says that um, people have the right to do whatever they want, and so possibly then maybe there should be a tax if people are allowed to do whatever they want. But then there should be repercussions for this. Or on the other side, autonomy says that everyone should be allowed to do what they want. So maybe there shouldn't be a tax because they're just doing what they like, and it's their choice. Beneficence says that it's quite possible that if there is a fat tax, then maybe people will stop, will be more cautious of their weight. But then on the other side, it could be financially draining on people who might have weight problems, and that's not beneficent at all. Justice says that everyone should be treated equally, so potentially there shouldn't be a fat tax. And even calling it a fat tax is quite derogatory. But it's very important to think about all sides of the debate. And it's very important to think about uh, who is affecting who, what externalities there are, and in the long run, will it actually be beneficial? And the final ethical conundrum in this PowerPoint we're going to be talking about is, should people with a BMI above 24.9 be allowed to be doctors? Should doctors have to complete a physical fitness test? So I'm going to give you 3 minutes for this one because it's quite more difficult. And then we'll reconvene and talk about this. So just to clarify, a BMI of above 24.9 means you're, I believe it means you're overweight. And so you should, does that mean that people who are overweight should not be allowed to be doctors, or should they be allowed to be doctors? And maybe if they're allowed to be doctors, what example does that set? Or if they're not allowed to be doctors, what example does that set? And to clarify the physical fitness test, I mean the kind of test that, for example, the army might take, where they have to meet a certain physical fitness requirement to be able to practice as a doctor. So your 3 minutes start now. Okay, so that's 3 minutes, and here's some points that we could talk about. So if a doctor is of an unhealthy weight, then potentially this could mean that they're setting a bad example. That if they are giving advice about how to, for example, if they're giving advice about how to maintain a weight or a healthy weight or a healthy diet, patients may not take it that seriously if they themselves are not of a healthy diet. However, on the other side, it's your as a doctor, it's not your physical capability that is so important as much as your ability to give advice and prescribe medicine. So perhaps it's not that important. The hospital can be a very tough place. It could be a very stressful place, and so they need to be able to be physically and emotionally able to handle it. So if someone is possibly not physically so fit, then maybe they wouldn't be able to handle the stresses of a hospital as much. So perhaps they, in that respect, maybe they shouldn't be doctors. But on the other hand, if they're emotionally mature and they're able to handle the stress of the work, then maybe they should. And to think about the physical fitness test, I mentioned the army. Well, I read something where it said that a hospital is a comparable environment to a battlefield, because there are people hanging on to their lives. People are dealing with lives. Every situation is continuously changing, and the doctor has to be at his best performance at all times. And so it can be very physically draining. And so if they can pass a physical test, a fitness test, then that would say, like the army does, then that would say that they are physically able to do this. In which case, that it might mean that it would not, overweight people might not be able to pass the test, which by default means that it's doctors can't be overweight, or overweight people can't be doctors as well. So there's lots of ways to consider this, but again, it depends mostly on opinion, and we would love to hear your opinions in the comments below. We'd also love to hear your reasoning behind each thought and argument, so please feel free to put that in. So if you would like to contact us, please get in touch. Our email is themedicaldebate@gmail.com, and you can message us on Instagram at The Medical Debate. We run live Zoom sessions every Saturday from 4 p.m. to 5 p.m. And if you would like to get in, if you would like to participate in those, please email us and we will send you the link. Thank you very much for listening to this session, and we hope to see you in another one.